Another thing that stands out to me in nursing school as a time that I remember looking back on it now as really kind of building my understanding of the kind of nurse that I want to be and how to provide spiritual care through action was during skills lab in the first couple weeks of school. And our professor was showing us how to administer an enema. Of course, for the patient, to receive an enema is potentially embarrassing, could be awkward and uncomfortable on top of it all. And I just remember that my professor created an environment for the patient that was caring, open, respectful, understanding, and it just felt perfect. I feel like a lot of that came out of the way that she was speaking to the patient. I remember her being very concise in her word choice, articulate, and also very direct. I think that the thing that stands out to me most was her explaining everything to the patient. She told them exactly what the procedure would entail before doing it, and also explained it during. She touched the patient's shoulder once in a while and was just direct about it. She didn't gloss over anything that could have been awkward. She said, instead of, "Okay, here we go," which I think I would have said as a new nurse, she said, "I'm inserting the tube now." And I feel like that kind of directness really acknowledges the patient's intelligence and kind of empowers them by giving them an awareness of what's happening with their body. And I feel like the whole demonstration was just the picture of honoring and building up a person's dignity in a vulnerable situation. And I remember walking away from it thinking, my goodness, if I were to have an enema, or if my grandma had to have an enema, I would want her experience to be like that, because it was so soft and kind and real.